So I think that was very exciting work that was recently published in Science by Alberto Ascario's group from Harvard. So of course, this knowledge of an association between EBV and infectious mononucleosis and multiple sclerosis goes back many years. So there have been multiple studies that have helped to establish this association over time. But the Harvard group did have a very unique data source. They've published some of these results before, but I think it was an important update. And they also controlled for some other factors, such as exposure to other viruses, which made the work very exciting. So in their cohort, they have these military recruits who donate blood samples annually, and they were able to identify people who were EBV negative, which is of course quite rare in the adult population, who subsequently developed multiple sclerosis. And in all cases, they had seroconverted to positive EBV status before they actually developed clinical MS. And then I think what was unique as well to this publication is they bolstered the work by showing that serum neurofilament light chain levels increased with the development of MS, but it wasn't a smaller subset of patients and the confidence intervals were quite wide. So I think that needs to be validated in other cohorts. And then they were able to investigate other viruses to show that they did not have any such similar association with multiple sclerosis. So they really brought this work about EBV together very nicely. I think it's generated a lot of discussion, which is wonderful. I think, as the authors suggested and other authors have suggested since then, we should pursue trials looking at an anti-EBV vaccine to see if that would be useful. And it also raises a question of whether antiviral therapies against EBV could be useful in preventing MS soon after infection. So I think there is more work to be done in this area, but it is very suggestive that EBV might be that initial trigger. We do, think there are other secondary triggers as well that must occur for individuals to go on to develop MS.